In today's Eye on Health, we are celebrating nurses for the start of National Nurses Week. As I said earlier, my mom is a nurse, and I know how dedicated and selfless these men and women are, especially now in this critical fight against COVID-19.
And Heather got a chance to see how Allegheny Health Network is celebrating nurses as the hospitals resume elective surgeries and appointments. That's happening this week.
I did, and I started my Zoom interview with AHN's Chief Nursing Officer Claire Zingurli, and Chief Medical Officer Don Whiting by thanking the nurses and asking how hard their jobs have been during this pandemic.
Our nurses at Allegheny Health Network have been amazing, I must say. They have stepped up to the plate. They have run into the fire, as you say, and they really are wanting to do as much as they can, and as they want to work as hard as they can to help us combat this virus. They're stepping outside of their comfort zone. We have OR nurses, operating room nurses going into the ICU to train to be ICU nurses to prepare for any type of surge. We have nurses on the med surge floor that are volunteering to go into the ICUs. We have nurses that have been downstaffed because we don't have enough work for them because the volumes have decreased so much that they're saying, give us things to do. If we need to support the nursing staff at the bedside, we will do it. And just tell us what you need us to do. They're at the testing stations, the mobile testing sites, they're screening employees and visitors as they come in the door. Anything we ask them to do, they do. But what's great is they tell us, hey, let us do this or let us do that so that we can stay working and we can stay as part of the team.
I have to imagine, as I said, my mom is a nurse, so I know that drive and that desire to help. But I also remember her saying, when we were at home sick, she had to put her family aside so that she could be there for the patients who needed her more at that time. And that can be sometimes emotionally tolling.
Absolutely. And what we've done is we've checked in on our nurses regularly to make sure that everything's okay with them emotionally. Because even though we haven't had as many positive cases as they've had in other places like New York and Detroit and New Orleans, it's still the pressure and the culture of a new normal for them. Wondering if this patient is positive or ruling out, or it's not something they're used to. They're putting on protective gear that they don't normally put on before they go in a room. They're bundling their care before they go into the room or when they're in the room. So it's a different way to practice nursing. So we're checking in on them regularly. And because we've had lower volumes, because we haven't had as many patients in the hospital, we've had more nurses to tap into so that we make sure that we don't have that burnout with the nursing team. Interestingly, when they canceled all the schools, we started and closed the daycares. We started asking all the staff nurses, are you okay? What can we do for you? And they started supporting each other and saying, okay, I've got this high schooler that's home that can babysit for you while you go to work. Those types of things. It's just been the human spirit of what they've done has really come to the forefront.
As we start to see normal operations and procedures kick back into gear, going back to normal practices, for both nurses and doctors and the rest of the hospital staff, what kind of precautions are going into place?
We make sure that, number one, that they're healthy and that they have not been exposed in the community and home, that type of thing. When they come to work, they all have the protective equipment that they need. They are not wanting for anything in terms of protective equipment. They have a fanny pack to carry their protective equipment in. We have mechanisms for it to be cleaned for them, and they are very well taken care of. They feel safe, and we feel that we've done everything we can to keep them safe.
Okay. And Dr. Whiting, do you want to add to that?
Absolutely. Claire did a very good job of talking about the screening that we do for our employees and for our patients coming through. We liberally test anybody who may be symptomatic from COVID. Like she said, we take a lot of the precautions around personal protective equipment, supply patients with masks if they don't have them, although everybody usually does at this point. We are deep cleaning our offices every couple of hours, all the surfaces with disinfectants. We are changing our office settings to have more social distancing in waiting rooms. We're extending our hours and adding days on the weekend to accommodate surgeries and things that need to be done, because it is safe to come back into the hospital at this point. Social distancing was to stop the spread of the disease, which we did very well, particularly in this region. But the safest place really to be is in the hospital, because all of the precautions are taken.
I know a lot of people are anxious to get back to a normal way of life. And honestly, some of that means that some surgeries that may not have been top priority have been put off, but have still been a priority for that individual. So I know that a lot of people are anxious to get in and get those procedures and operations done.
Yes. Actually, we were hearing a lot about people staying home too much and bad things happening at home, heart attacks, people staying home with broken limbs because they were afraid to come in. That really is more harmful than coming in is safe. Staying home is very harmful at this point. So we are getting people in priority as the ones who are the most in need and have been waiting the most. But we want to encourage people to know that it's safe to come in and don't stay home at this point when you are ill, because you need to seek treatment when you need it.
Well, thank you guys both so much for not only doing this interview, but for everything you're doing every day to keep us safe. I mean, I know it's not just during this unique situation, but every single day.
So thank you for this. We appreciate it.
Thanks.
Thanks.
They were great to talk to. And that really was surprising to me to hear that people were getting hurt, various accidents or health issues, and fearing going into the hospitals, but they are ready and willing to accept any patients. If you have an emergency, don't hesitate to call.
What great information too, because someone gets hurt and is afraid to go. That's a horrible situation. So
and the nurses coming together to help each other, just fantastic stuff to hear. We also want to say congratulations to AHN for getting excellent marks in most recent leapfrog analysis of all safety measures in places at all of its facilities. It's a critical designation as they resume elective surgeries this week. And Dr. Whiting, who we just heard from, says that he's so proud of everyone, especially the nurses, for the work that they've been doing to keep everyone safe.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.